Kaiser was an 11-year-old who unfortunately had an injury at school, which resulted in an injury to a major ligament in his knee, which is the ACL ligament. This is becoming an increasingly more common problem that we're seeing in our younger athletes as they are involved in sports at a younger age. We're seeing these athletes who are going to be involved in a higher level of competition at a younger age, often involved in one sport in a year-round situation. This is leading to more adult-style sports injuries that are occurring in these kids at a obviously younger age. When you're treating these problems, when you have an adult problem with an ACL injury or a specific adult injury, sports-related injury, we can't always use an adult technique in a pediatric child. Some of these children have growth plates that are wide open, and if we use adult techniques in them, we can damage that growth plate, which can cause angular deformities or growth discrepancies in their legs or in their other extremities. So we have to use specific techniques when dealing with this problem. The technique that I used for Kaiser was a technique which was championed in Children's Hospital of Boston. It has been something they've been using out there for over 40 years in patients with wide open growth plates. And this reconstructs the ACL without, or at least with a very minimal risk of damage to the growth plate, and allows them to get back and function playing in sports in about 6 months. So far, Kaiser's doing well. We're only 1 week. Kaiser's rehabilitation. He's right where he needed to be. Today was just an easy check on Kaiser and to answer any questions concerning the brace and any other questions they had about post-operative changes. I expect Kaiser's course to go accordingly over the next several weeks. I will be following him again next week with another visit at 6 weeks and then 3 months from surgery. Unfortunately, we've got a couple more weeks in this brace, but it gets better. All right?
Get better.
It will. Kaiser will be wearing this brace that we had him in today for the next four weeks. We then transition him into an ACL brace where he's walking without crutches at that point. At 3 months, he is not wearing a brace and he is walking normally, but he is not allowed to return back to sports activities, which include running, jumping, cutting, and pivoting, for about 6 months after surgery, which is the same thing we would do in our adult population. Pediatric and adolescent sports medicine is a relatively new offshoot of the sports medicine in the adult world. Pediatric sports has changed significantly over the past few years. We have seen an increase in the number of participants in sports as free play has declined, organized sports has increased. We've also seen an increase in the number of injuries, both acute and overuse related, essentially because of the sports that they're playing and the amount of sports that they're playing. Our children aren't just doing, as they were several years ago, involved in a multiple sports over a year process. They're now focusing on one sport, often playing on multiple teams, which include travel teams and select teams, often doing several hours a week playing this sport. This is leading their bodies, their young bodies, which have a lot of growth and areas of weakness, to sustain either overuse injuries or injuries which we are seeing in the adult population. The answer to that question lies in the fact that you have to understand that the child is not a little adult, and the pediatric athlete is not a little adult athlete. And there are significant differences between the two, especially in their bodies and as they're healing. And use of adult techniques in a child athlete do not always treat the problem correctly. And oftentimes waiting until they're skeletally mature does not often give them the answer that they need or allow them the ability to get back and play sports. My fellowship training was done at the Children's Hospital of Boston for sports medicine. It's the only fellowship that's ACGME accredited for pediatric adolescent sports medicine. The techniques that I learned there under the mentorship of Dr. Coker and Dr. McKaylee, who are the pioneers of pediatric sports medicine, have really given me the ability to offer this to our area, where nobody in our area was previously taking care of these problems using these techniques. Originally, I'm from Western New York. I was born in the area. I went to high school at Lewis and Porter High School, and then went to University of Buffalo for my undergraduate. And also did master's work at Roswell Park Cancer Institute. Following those 2 degrees, I left town for about 10 years, where I did my medical training in New York, in Cleveland, and in Boston, and then have returned back to the area, 10 years later. As my family is here, and both my wife and I are from the area, that we've returned back here with our family. The only institute that was really doing this procedure was the Children's Hospital of Boston. Now you have to remember that in the past 40 years, we've had this slow increase in the amount of these sports-related injuries. And it's really started to explode over the past decade. So even though they've been doing this for a long time, we get to follow those outcomes over those years, and we got to say, you know what, the surgery worked. It lasted 1 year, 2 years, 5 years, 10 years, where it was originally done as a procedure that was a temporizing procedure. We're going to treat this now so that you don't get further injuries to the other cartilage in your knee, with the thought that you might need an adult procedure done later. We found that most of these cases don't need a second surgery done, and they just need this surgery, and then they're good to go from there going forward. Now, it's in this past decade that we've seen this explosion in sports, in pediatric and adolescent sports. My son, who's 3, was involved in playing soccer this year, because they have 3-year-old soccer. So when you're starting organized soccer at these young age, you're getting these kids geared up to play the sports. And as many soccer moms or hockey moms in Western New York know, these kids play this sport all around the clock, and they're playing one sport now. You're not getting that kid who's playing football, basketball, and running track. He's playing football year-round. He's playing baseball year-round. He's playing soccer year-round. So this has been, part of the cause of this has been the competitiveness that we see, in the sport itself. But we're also seeing another flip to it, is this might be the way that our kids can go to college, is to get this scholarship. And there's also been a big push for that as well. What we have to do is we have to understand that, well, I believe that organized sports are good. And I think that's an important part that you have to understand. There are many benefits to sports. We currently see the 2 epidemics in our pediatric population. We have pediatric obesity, which we see a lot in the literature about, and that's kids that aren't doing anything. And on the other side, we have these sports-related injuries, where the kids are doing too much. Somewhere in between the two, we have to find the right balance. So doing too much at a young age can put them at risk, can hurt them, and we want to prevent that by showing them the rules and the regulations that they should be following. And there are certain standards that are out there that help guide parents through this and prevent injuries to the kids. That when an ACL tear occurs, the natural history of this ACL is that knee can sublux again, which puts at risk the other cartilages in the knee, the articular cartilage and the meniscal cartilage, for further injury, which can then cause more pain and lead them down a path to arthritis. So knowing that was the history of how we used to treat this, was put them in a brace or just say that it didn't happen. Or you'd say, okay, you did have an ACL injury at the age of 11. You need to wait until you're skeletally mature before you had a procedure done. So you have to take an active, 10 or 11-year-old who was playing sports and say, you're not allowed to do any sports, running, jumping, cutting, pivoting activities for the next 4 years. It doesn't work. So, and we have options now that we can do that can get these kids back in the game in 6 months safely playing again.
We're here because my son had an ACL reconstruction. He was in gym class and he fell and hurt a pop, and we came to Dr. Gambacorta and discovered that the ACL was detached. He was in a lot of pain at the time of the injury. It affected, what he does daily, being able to play sports, function in his daily life. He's very active, so he was restricted from activity after his injury. The injury was very stressful on Kaiser and our family, and put a lot of restrictions on our normal daily routine. But being able to meet Dr. Gambacorta, he has been available at every need that we've had, every phone call, every small question. So he's made the process much simpler and much less stressful for us. So it's been a joy to have a great doctor that can explain things to us that we can have to support Kaiser. That we have a resource to go to with educated, doctors and nurses, people who care and support the family, people who come together as a community to help others. It's a great resource to have here. We're lucky.